Our next speaker is Dr. Pauline Lucas. She is a physical therapist at Mayo Clinic in Arizona and specializes in pelvic floor dysfunction. And she's going to chat with us this morning about pain.
So my topic is myofascial pain, myofascial pelvic pain, and the role of physical therapy. And let's see, that's where we go. And I have three goals. I want you to understand what myofascial pelvic pain is, how to recognize it, and the role of physical therapy. I'm thrilled to hear so many speakers highlight the role of physical therapy in the care of your pelvic health patients. So let's start by defining chronic pelvic pain in general. So it's pain in the pelvis, in the lower abdomen, including umbilicus, can be in the buttocks, and it is typically over 6 months, and it's non-cyclical. It affects about 15% of women worldwide, reproductive age. And this is an important one, is multifactorial. And if you are a physician who is actually dealing with this or a practitioner dealing with this, you would agree with me that it's complicated, right? There's many factors that play a role. According to this article, 30 to 70%, which is a huge spread, have a musculoskeletal etiology or at least component. And really the way to summarize this is most women with chronic pelvic pain have some degree of myofascial pelvic pain. The nomenclature is very complicated too. There's a lot of different terms to describe the same thing. High-tone pelvic floor, non-relaxing pelvic floor, levator ani syndrome, pelvic floor tension myalgia, muscle spasm, pelvic pain syndrome, and I love the diagnosis or the code or the description of myofascial pelvic pain. And so what is myofascial pelvic pain? Well, we're dealing with pain in the pelvic floor muscles or the fascia or the connective tissue or all of them together. And it can be just a standalone problem, but very often it's really related to other issues that are going on in the pelvis. And a typical presentation of myofascial pelvic pain anywhere would be that there's taut muscle bands, and often there's trigger points. And it can be generalized muscle pain, and it can refer to other parts. If you don't know what a trigger point feels like, most of us can find one in our own body at an easy location, and that's right here, the most common one. So if you put your hand on your shoulder, you dig in with your fingers, there is a chance that you find some tightness there and maybe even like a small area that radiates pain elsewhere. If you don't have that, you can ask me later, you can feel. And sometimes there's a twitch response when we push on it, which is easy to see in the neck or the back, not so much the pelvic floor. And typically there is pain that refers. So here are some examples of referred pattern. So the top picture is trigger points in the sphincter and in levator ani.